You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. We're back at Stellar Success Podcast. Dr. Tudor Francu, I'm your host, and I have a great guest today, Dr. Betro Sadek from Massachusetts. How are you, Dr. Sadek?
I'm doing great. Thank you very much. I appreciate your inviting me here.
Sure, absolutely. I just want to start with a very straightforward question that's probably has a long answer. What is success for you?
Success is like happiness and to do what you want to do. So basically, the sense of fulfillment, that would be the success. It doesn't have to be a certain title or a certain position. It would be, I'm doing what I'm happy to do, waking up every morning, doing something I'm happy about. I'm successful.
Yeah, that's a very straightforward answer.
The way I look in, go ahead. I would like to say the way I look into it is you do your part and you're satisfied about the outcome, that would be success. I don't like to label it with a certain level or degree or score. It is the self-fulfillment. That is the part that would make me feel I'm successful or not.
Yeah, I agree with that. So tell us a little bit about yourself. What was your journey? How did you start? What did you learn along the way, and where are you now?
Absolutely. It has been quite a long journey. I am a foreign medical grad, basically a physician who got trained overseas outside of USA. I was trained in Alexandria in Egypt. I am an Egyptian person, and I got my education over there. After I finished my medical school in Egypt, I realized that I would like to practice medicine in USA. And I got the opportunity first to come to USA as an observer and Cleveland Clinic. Over there, I was like wowed about the medicine practices here in USA. It was really nice, and I thought that I can make an impact if I can join such a system. I finished my certifications exams. It's called USMLE. And after that, I decided to focus more on like what is evidence-based medicine. So from that perspective, I joined Mass General Hospital. I worked over there as a research fellow, then became an instructor at Harvard. It was a very fruitful journey to learn about the research and the outcomes and what you mean by evidence-based when you get exposed to that term when you learn. I became a family medicine resident in Toledo, Ohio. I joined St. Vincent Mercy Hospital over there. It was a very interesting journey as well because you have a perspective about what you would like to do in life, but you realize that not everything that you hope for yourself is actually the best for yourself. I believe in God, so I think it's like directed me to the specialty that I would fit perfect to it, which is family medicine. I like the breadth and the width of the diversity of patients population and learning about multiple diseases. I would love to know something about everything more than learning everything about one thing. So after that, I became a hospitalist in the same healthcare system. And over there, I embarked on two journeys at the same time. One of them is clinical medicine, and one of them is clinical informatics. Both of them was very intriguing and exciting adventures. One of them, which is the hospital medicine, basically that's the physician in the hospital who admits, discharges, round on the patients. And if they need a consultation for like a heart cath, I call the cardiologist, but the patient is mine. I admit them, I discharge them. It was the perfect position for myself. I spent 3 years over there while my wife was doing her training as well in internal medicine. And I joined the clinical informatics field, basically the gap between the engineer and the doctor. So it was a fruitful journey as well. I fell in love with the EHR system. I was able to contribute, touching more patients by fixing the computer more than the number of patients that I would see every day in my clinical practice. After that, I went to Oklahoma. My wife was able to get a fellowship over there. So I joined another healthcare system over there. It was an amazing journey. Over there, I got trained more officially on the informatics teams, with the informatics team over there. After that, I joined South Carolina. I came to South Carolina when my wife got her dream job here near by our house. I became a board certified in clinical informatics. Besides being a hospitalist, I became a certified physician executive. It has been a long journey, full of adventures, full of ups and downs, but so far, very rewarding. It has been a very humbling experience across the whole continuum of care.
Yeah, that's indeed a very interesting journey. I haven't seen a lot of people going into medicine, family practice or internal medicine, and ending up in a clinical informatics domain of medicine. Because one of the things that I'm thinking is that very few people have knowledge about the informatics in medical school. It's something that we're not taught. There's no course about that. There's no curriculum to learn from. So it's obviously something that you did maybe on the side as a hobby initially. And obviously your mindset was thinking out of your comfort zone and going into this kind of realm of unknown, I would say. So what was the point in time and your mindset to switch and get you interested in that domain?
Actually, it's a very interesting and funny story. I loved EHR and how can I be more efficient and provide more safer care, higher quality care for my patients by the electronic health record. So the electronic health record serves as the gate between the patient and the doctor. So anything I wanted to know about the patient, I asked the EHR about it. Hey, what is the blood pressure for my patient? So it is the way that the patient tells me about his condition, even if he tells me verbally, but if it's not in the chart, I don't have the complete picture. On the other hand, it is the same way that I send the information to the patient. If I'm ordering an X-ray or I'm ordering the lab test, it also goes through the EHR. So optimizing that was something makes the care more safer, higher quality for the patient, and more satisfaction for the provider because they can provide an efficient care. I played with that. Then I found that I can do stuff much quicker, much better, much easier. So people were asking me, hey, how can we do this? How can we do that? So I was explaining to my colleagues, my friends, how can we improve on stuff? Then I was invited to Didactics to talk about the EHR tips and tricks. And that was for my colleague residents. Then I was going for another residency programs because they heard about it. Hey, Betro can help us with this kind of stuff. Cool. Then I went to physician meetings, which is the attending, the one who supervises me. Then somebody told me, you should go for clinical informatics. That will suit you very well. I told him, what are you talking about? I have zero clue about that terminology and I have no knowledge about it. That person became a mentor to myself. His name is Dr. Bertka. And from there, I did learn a lot about clinical informatics and how it works. It is basically everything that has a relationship to any computer between the patient and the provider. From electronic records, from X-rays, from imaging, from laboratory workup, from pathology, from gene sequencing, from medications, all these kind of practices, it's all what about clinical informatics does. And the workflow itself about patient coming to the ER, then go to the OR, then go to the hospital floor, all of these also part of that whole system. I found my passion there because, as I mentioned, if I can't fix one thing, I can affect so many patients more than what I can help them personally by me examining them and taking care of them personally. So it is a greater good if I can do a positive outcome. One patient I can save and prevent his negative outcome, even by not my direct intervention or not even knowing that patient, but because I provide the appropriate tool for the other providers. So that was a pivotal point during my medical residency. And after my graduation, I had the liberty to pursue it further. And course after course, training after training made me tailor that and hone these skills to make it more efficient so I can provide an amazing outcome for my patients, for everybody's patients.
Well, yes, obviously for everybody's patients. I was about to say, there's not one doctor I've met that it's very fond of this new computer system, medical records. And it's very easy. I mean, obviously nowadays AI is probably going to do a lot of this stuff from now on, but a lot of doctors have issues when they start recording the medical records on a computer because it's an intricate system. Most of them don't have the knowledge or the skill to do that. And I think your niche of success is very determined. And I think it helps a lot of people from that point of view. And I wish, this kind of informatics knowledge would be much more available in school system, in medical school also, because that's the reality we live in right now. We don't have, handwritten paperwork, medical records paperwork anymore. Everything is like computerized.
It's happening actually already right now. Like right now, it's happening in the curriculum that they have to learn a little bit about clinical informatics and about the EHR system.
Yeah.
Because the more you are not able to learn about that, the more you're going to struggle. How are you going to implement the care that you want to provide for your patients?
Absolutely. And all the systems are so intricate right now that, one information that goes into a computer shows up in 10 other computers about that same patient. And also, I mean, everybody knows that kind of data once it's available. Obviously, privacy issues would be respected, but it's something that it's very interesting and it's going to develop, probably better, and develop into a much greater monster from now on. But it's an interesting field, and I think we can talk a lot about the subject. What I wanted to know is, does it take a lot of skills or habits or different traits for a medical doctor to be able to learn and master what you're doing?
I think it takes, number one, I think you would need passion for it. The trait itself, I think it's very helpful. I had seen colleagues who did not want to do it, but they are doing it. But honestly, if you don't have a passion for it, I don't think that you are not deemed for success. I have like an idea in my mind in general that would circle back to your first question. If I'm not waking up from my bed every morning, going to work with at least some excitement about what I'm doing, for me, it is going to be just a duty or a task I have to fulfill. And once I'm done with it, I'm out of here. And that would make me provide the minimum that would be required for me as a person. If I have a smile on my face when I'm doing it, that would make me feel fulfilled. And I'm willing to put an extra mile. And that goes way long to help myself and everybody else in the future. So the niche about clinical informatics is like, if you would love it, you have to have some traits, sure. But the idea is if you don't like it, you should not continue doing it. Because the passion about it is the one that will make you have brainstorming, your flow of ideas. How can you help this? How can you do that? Because it's all innovative. You don't have a standard to work on. Like, I would like to improve this workflow. Then you have to imagine what would be the future state. Then you try to apply. Then you do mistakes, learn from your mistakes to improve forward. All of these are visionary about the future state. So I think that would be the personality that would fit for clinical informatics field.
Yeah. Yeah, I totally agree with this. Passion is probably the first and most important thing you do in anything in life. I haven't seen any successful people or person that does something without passion. So I think you're very right on that. Another question that I have is something that came to my mind many, many times in the past few years. And it's the relationship with a patient once he gets into an office. Sits down, starts a conversation with the doctor, which usually is very limited because of the, many insurance constraints and payments and reimbursements and all this stuff. But that conversation goes right out the window the moment the medical doctor sits down and starts writing on a computer. Because I feel like there is a disconnect between the clinical portion of the visit and the human interaction and the recording of that human interaction on the computer. A lot of doctors have are very anxious to record and write down and type immediately what the findings are in the computer to be in there, not to lose time. But I feel like that human interaction and clinical judgment is hindered by this aspect. How do you see, as a clinical informatics medical doctor, how do you see this so-called conflict?
That is actually very interesting. And that's why I feel something like what you exactly mentioned is a big dilemma. Efficiency and safety for what you need to provide for your patients, and you don't want to miss an information, you don't want to miss some part of the discussion, you want to put it right away in the computer, but at the same time, there is no personal or human interaction. It has been a struggle for too many providers about that, and the provider who will provide the human interaction more and wait on the computer as much, usually they take it on their expense to, after the clinic done, he's going to spend 3-4 more hours doing the computer work. I am glad that we are in the era right now of much better solutions. So right now we have like an ambient technology that literally I can put my phone with the permission of the patient to record the encounter, and the AI will help us write my note, provide some of my orders based on the discussion. So basically I can focus more on the patient and provide my compassion, provide my guidance, build my rapport with the patient, and listen to him, make him feel that he's heard very well. And that would build the trust, which is an essential corner for a treatment strategy. Because not all the treatment is going to be a benign treatment. Some of them going to be very harsh on the patient. Why would that patient accept something that really can cause some pain for them? The only way is if he knows there is a greater good, how he can believe in that. Only trust. So that trust you can build with your doctor if you believe that, yes, he has the signs and he had my best interest as a patient in his heart. I trust him and I trust his knowledge. Yes, let me do that aggressive treatment plan that I would need to do. So clinical informatics can help with that. Ambient technology, I can transform the whole encounter into the computer without me had to sit in front of the computer and keep doing this. I can utilize the machine learning and the AI to transform the whole conversation into a note that I can proofread and sign after the end. And I can go back actually and learn about what's in that conversation. And some studies have shown that that's actually had a better outcome because you possibly miss some of the information with the regular human interaction, but the computer doesn't. So it's get better. So technology solves something very human. So it is very interesting.
I love your answer. I think not only this is the answer, but I think this is the solution to maintain that still human interaction between the clinician and the patient, not forget data from the interview, and also record everything and create a treatment plan. So that's why I think, you started in clinical informatics, but I think this domain really sky high explodes right now into the AI realm of uncontrollable, I would say, tasks that an AI can do from a simple interaction in an office. And like you say, create a HMP, create a treatment plan, create discharge instructions, whatever else, the patient needs to do. How do you see this evolving from a simple computer software to an AI-based treatment plan?
So I'm very skeptical about treatment plan. Anything else, I'm okay with it. But I feel it is not right at the minute that the AI will start proposing treatment plan to be something can we rely on. Personalized medicine is very essential. And that is going to be very difficult for AI because they have data to train on. This data may not represent the patient in front of me because each patient is a unique patient. So I would love to utilize the AI for the maximal what they can do for me. Summarize the chart. Sure, and AI can interpret, summarize, proofread, and give me a quick summary so I can help my patient quicker. That's efficient way. For example, record a conversation ambient and write a note for me. That is amazing way if I can proofread it. But suggesting treatment plan, that is something I think we are still very far from, because it will provide a generic treatment plans that might not fit my patient and that can cause harm. Not every provider would put all perspectives in their mind. So in a very long day, at the very difficult moment, a suggestion might skew the providers and the physician's point of view about what would be the best next step for that patient. Unless I see a good evidence about it, I don't think it is the route to go yet. There is like a good saying in clinical informatics, like, in God we trust, everybody else bring data, So you don't believe in the system except when you know it is bulletproof, that would not cause harm. So for investigations perspective, I love AI. From treatment perspective, I'm not there yet. I would not feel strongly about it except when I see evidence that it can work in certain scenarios.
Yeah, interesting. I'm sure eventually they'll get there, but like you say, you probably have to have some kind of control about the decision-making process of a treatment plan for a specific patient that you have in your office. You're a 40 medical graduate. I'm sure you've been through a lot, and I kind of know that myself too, because I was in the same situation. But what I want to ask you is, was there any moment in your life, professional life, that you had a setback or something that didn't turn out the way you wanted and pushed you forward to where you are right now?
Absolutely. I am not embarrassed to say the first time I tried to match into the US medical residency, I did not match. And that was actually like a moment in my life. It's like, oh, so I can do the whole effort. I can do all what is needed from me, and still doesn't work. That was an educational moment for me, that it is not mathematics. That is not, you do your part, you're done, you're good. So perseverance and resilience and some grace that you would like and that you would need in your life can push you forward more. Support system you need that. So anybody would think that I can do this alone, that's not going to happen. So you need a lot of people around you. You need a lot of grace. You need a lot of perseverance and resilience. So I think that was something that I learned from, that I have to put my best foot forward and I have to keep pushing, bootstrapping, but that is not enough. But you have to be persistent. If you want to achieve something, you keep working on it till it's get done.
Just like in clinical informatics.
Exactly. The projects are not straightforward. And actually, the good impact makes a very nice impact and widespread. And the one mistake can cause a disaster across a system. So it is high stakes as well. So it is something that, like I would call it like a sword with two blades.
Yeah.
One can do a very good cut and one can really make a big disaster.
I remember someone telling me they were working on the Epic system and they made for several hours, and they made a small mistake and they had to redo the whole thing all over again for some reason. And just they threw their hands in the air and they were like, "I'm done with this. I can't take it." It causes a lot of pain for a lot of people, right? What do you have any piece of advice coming from inside the issue for someone who starts learning the system, starts practicing it? Any piece of advice to make it easy?
For a user, I would say yes. Every hour, or let's take any unit of time, every 10 minutes you spend in learning the EHR, you save 5 minutes every day of your life. So it might feel on that day, oh, this is going to take a little bit more and I don't have the time for it. Never, ever say that. So, for example, you are typing a note and you know that you need to fix your template somehow, but you don't have the time for it. That means every single note, you are doing some backstrokes, deleting what you don't like and adding few words, what you like, every single note. Just go fix this template. That might take a little bit longer today, but it's going to save you 50% of that time already. You saved for the rest of the day. And from tomorrow, for the rest of your life, you save that amount of time. So my 2 cents. Every 10 minutes you spend in fixing your workflow, template, HR, ordering, doing all of that saves you 5 minutes every day for the rest of your life.
Interesting. I bet they'll take this advice.
Most of the people does.
Tell us about your daily life. How do you structure your day for being a successful doctor? What do you do every day? What kind of habits and routines do you have that you think make your success?
Let me rephrase to make it more tailored to my answer. I used to have a regular routine, wake up, do your bathroom routine, whatever, then get your cup of coffee, then run to your car, go to your work, and keep running from one thing to another, Come back home, meal with the family, homework for the kids, X and Y and Z, the same as everybody else. But the piece that really helped me not to get burned out is to slow down. If I finished my task, whatever it is, work, home duty, shopping, anything, few minutes earlier with higher pace, that usually leads to a quicker burnout more than if I took more time with a smile on my face and I know that I can finish this in 3/4 of the time, but I'm taking my time doing it, giving me a peace of mind and less burnout so I can survive the day and complete the task without feeling tired or burned out again. So the idea of slowing down or even driving fast, why about just driving just below the speed limit by 1 or 2 and enjoy the scenery? I'm already late on my appointment by 10 minutes, so it's okay. Let's make it 15. I'm late. Rushing would make the day much worse for me and everybody else because I'm going to be tempered. I'm going to be rushing. I'm going to be pressured. Whatever happens, happens. I live the moment so I can enjoy it. Enjoy the current moment because if it passed, it's time lapsed. I cannot bring it anymore. No amount of money in the world can bring more time. So I feel about I have 24 hours in the day. Think about it like if you have $2,400 a day, what you going to do it with it? Either you're just burning them around or if you're really buying something and enjoying with that amount of money. So it's not a certain habit, but how I practice every single thing in my life is by just slow down and enjoy the task instead of feeling burned out by it.
That's a very good advice. And it's very rare I hear that. Just slow down and enjoy life and make the most out of your time because you never know what's going to happen next. And I agree with you. There's so many instances what everybody tries to rush from one thing to another and they're stressed out. Things don't work out. They get mad. Other issues come out of that thing. So slowing down is a good advice. I want to switch gears a little bit. And you mentioned burnout. This is a big issue for medical professionals right now. And I think a lot of people would relate to that and not only burning out, but also want to retire. They want to practice anymore. They want to do some other things in life, but they don't have the financial means to survive that because medicine, it is a profession that provides a good income. How do you see the optional choice of having passive income streams that can be built towards your life, during your life? And towards your retirement, you can live off of that. What's your impression for that?
It's definitely valuable, definitely an extra, and I think it's something very useful. And relying only on your clinical skill is very important for your self-fulfillment. But financially, it is a good idea to diversify your source of income. So having a passive income, it's a very good idea. Just don't lose money. So if you are investing, know what you are investing in, all sorts of investments, real estate, any of that. It's very interesting and it's very fruitful in the right set of and right opportunities. So it's definitely something I would be happy to do and happy to support but it should not be, because also there is a trend that it is about the money, and people leave some medicine to go to chase the money. If you are in medicine for the money, you are in the wrong profession. So I hate for this to happen, because we have lots of patients who needs help and care, but investment by itself is very important, and it's something that can give you peace of mind at a time of retirement or a time of disability.
Yeah, definitely. If you would give yourself an advice retrospectively with what you know right now, what would that be?
Learn more about taxes. That's for sure, because like it is an ongoing learning curve, and like it is very steep, and the more you know, the more that you know that how much you don't know. Same as in medicine. So that is yes, like yeah, I would love to have like a course of finances. Like I did not contribute to my Roth IRA during my residency because I thought that I needed the money. I never knew about the doubling time or something like that. Oh my God, like I should have started, but contributed,
Yeah.
So stuff like that. So yeah, it was a little bit late, but it's better late than never. It's okay.
Yes.
Stuff like that. So yes, absolutely. That would be my advice. Yes, that I should have learned about finances the minute my foot started on that career.
Yeah, that's a great advice to yourself. And this is one of the reasons we have this podcast, because there are a lot of people in our profession are not very well versed with the subject of financing and finances in general, and taxes being our biggest expense in life. You can get around taxes and death, right? That's the only two things you can avoid. So you better learn about them. Definitely.
Absolutely.
Dr. Sadek, what are your goals? What are you thinking in the near future? What excites you? What's coming up?
I would love to be able to make a bigger impact about clinical informatics. Instead of helping a certain department, I can help a bigger institution. Instead of helping a bigger institution, I can help a whole system in USA. After that, I hope to help the whole Earth, So my passion is about making a bigger impact, but not on the expense of personal happiness or self-fulfillment or time with my family. I started more and more think about what is more valuable, and a smile on my kid's face is very valuable. And if you waited on it, that kid is no longer in that age anymore to give you the same exact smile. He'll give you maybe a different smile, but not that age anymore. So I trying to do more with the slowing down to that the future is now. Let me just enjoy the now. Knock on the doors, whatever opens, but don't push too hard. Life is too short to spend all of it trying to achieve something that is not available right now. Enjoy what you have right now. Whatever comes, amazing. Didn't come, still good. Content is very important.
That's great advice, and a great point to end our awesome interview. Thank you so much for being here. Wish you a lot of success in what you're doing, and hope a lot of doctors will learn more about your domain, clinical informatics, and make it pleasant for them.
Thank you. Thank you very much.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.